Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I am your host, Dr. Celeste MD. I'm a board certified family medicine physician specializing in urgent care. I assist busy professionals with their acute and chronic needs via my virtual medicine business as well as my concierge medicine business. So good afternoon, guys, and welcome. Hi, Rabia. Thanks so much for joining. Hi, Dr. Janine. Thank you for joining. Hi, Ms. Harris. Thanks so much for joining. I apologize for the delay. If you're out there and have climbed on board today to take time out of your busy lunch schedule, we appreciate it. We apologize for the slight delay. We were trying to make sure that we had a good signal and that everything was ready to go. So we're just sharing with you guys today just an update about the 2019 coronavirus, also known as the CoVid19 virus medically. Hi, Dr. Mashika. Thank you so much for joining. So, ladies and gentlemen, we've been updating you over the past several weeks about this coronavirus. Just to go back and give a little bit of detail on that, you know that it was discovered that the coronavirus that has caused a global epidemic was started in Wuhan, China at a seafood market. This Wuhan, China seafood market is known to sell animal products, both live animals, dead animals, animal products. And it's suspected that that is the source of this lethal infection that is spreading around the world. So we're here today to give you a little bit of an update, to provide you just a little information. Hi, Mr. Willis. Thanks for joining. To give you a little bit of information or background on it. The coronavirus is a group of viruses that have been around for years. We've known about them. Most of the time in humans, they cause a mild respiratory illness like the common cold. In cattle and pigs, it can cause you to have like a diarrhea type illness. In chickens, it can cause you to have upper respiratory illness, as well as in other animals. Well, the coronavirus is a group of viruses thought to have started with animals and is thought to have been spread from animals to humans. Well, the difference with this particular strain of the virus is that this particular strain of the virus has been found to be lethal, especially for individuals that are older and have comorbidity. So let's move ahead to the update. We know that there are at least 80,000 people that have been diagnosed with this virus globally, and thousands of deaths, unfortunately. And so what we're doing today is updating you about the latest of what's going on in the United States. And the CDC announced this morning that there was the first case of what they're suspecting is community spread cause of coronavirus. As some of you may recall, there are two individuals who were on the U.S. soil who had not traveled out of the country that got the coronavirus, one in Chicago and one in San Benito, California, but those individuals contracted the virus from relatives who had traveled or been exposed and had the virus. So they were exposed to someone. Right? So this is the first case of someone who has not traveled outside of the United States, someone who has not had known exposure to an individual that is positive for the coronavirus. So this is the first community case. The theory is that this person may have been around someone that was a returning traveler from an area that had the coronavirus prior to that person expressing symptoms of the virus. Now, in this particular individual, there was a delay in testing when this person presented because the person did not meet the criteria at the time that the CDC has for people that need to be screened for the coronavirus. And we'll go over that in just a moment. So obviously, this is something that makes everyone uneasy. What does that mean? That means that there are most likely are more cases that are undetected out there, and that it's already started in the U.S. And we suspected this and have for the past several weeks. Physicians and healthcare professionals at the CDC, as well as physicians within the country, have suspected that because if you recall, we talked about that the virus is there's very little that's known about it. The only thing that we know is it spread human to human, and that the possibility that the virus is spread prior to the person presenting with symptoms. So that means that it decreases the way that you can kind of help quarantine it and keep it at bay. So that means people can spread it beforehand. This particular case of the community spread, and the individual that suffered with the community spread coronavirus was in Sacramento, California. And so that means that people in that area, the physicians in that area, will likely start increasing the level of screening of individuals. For this particular patient in general, they presented to UC Davis Medical Center. They were transferred there on February the 19th. And at that time, they're actually intubated on a ventilator and were on what we call droplet precautions. That is a precaution that we as physicians will put a patient on if we feel like, okay, this individual is someone that's potentially contagious. We may not know the cause of the infection, but we put them in an area and we treat them in a way with personal protective equipment, which would include and not be limited to masks, gloves, eye protective equipment to prevent the spread of the droplets from infecting the healthcare workers that are taking care of the individual. So that's a common thing. We've done that for years in the cases that we feel like someone has a potentially contagious infection. So upon admission, they asked about testing for the coronavirus, and they said that they didn't meet the criteria, so they didn't test them then. But then so on the 19th, that Wednesday, they didn't test them, but they tested them on that Sunday, and the test came back this week showing that that person was positive. So that means that we're in a state of where we're starting to see the low-level spreading or transmission, that it can spread through the communities. And as you know, if you've been watching the media, the CDC has warned about and been concerned about these things, which is part of the reason why we're encouraging you to follow a lot of the simple precautions that you can take to decrease the likelihood of spread of any kind of contagious infection to other individuals. Now, what the CDC is doing now to decrease the likelihood of spread of this virus throughout our communities and through our country is there's a diagnostic test that they created to be able to detect the coronavirus. What they've done is taken another step this week in decreasing the complexity of that testing. In other words, there were 3 steps basically to the testing. They've eliminated that third step to try and increase the likelihood for wider testing. It's very important that they've made this decision now because it's critical as we're starting to see the community spread. And so part of the reason why that's important and screening is important and asking all these questions, and part of the reason I'm sharing this with you today is so that you won't be alarmed or offended, or that you'll be, compliant with healthcare workers and individuals that are trying to help keep us all safe. And I'm going to go over in just a minute a couple of the things that will happen upon you entering into a clinic or most facilities, or if you're having symptoms or any of that. So the fact that they've been able to eliminate that third step with the testing is huge, because this means that they can test on a wider basis. That is important because if you're not screening for the test, so we have a virus that is spreading without symptoms, right? So that means that the screening for that virus is very critical and very important. And the CDC has stayed phenomenally on top of this in trying to decrease the spread of this virus throughout our community. Because if you're not screening, you're not going to find the virus. And so if you're not screening, that means some cases can go undiagnosed, which means that you're going to delay treatment, which means that the individual infected with the virus could suffer complications because of the delay in treatment, because there was a decreased level of screening. So now that we've increased the level of screening, they'll be able to hopefully detect a few individuals that are positive for the virus to decrease the likelihood that they will be exposing anyone else to the virus. So let's talk about what's going to happen when you go to a clinic, okay? So if you're someone that's out there, and at this point, the CDC has stated that people of interest or people under investigation, they call them PUIs, the categories for those people include, number 1, anyone with fever, cough, or shortness of breath that has traveled to an affected area outside of the United States, a globally affected area, and they're having symptoms, then that is someone that needs to be checked for the coronavirus. If you're someone that's out there and you've been exposed to an individual, whether you are a healthcare worker or whether it's someone that's a relative, friend, or anyone, if you've been exposed to someone that has the virus and you start having symptoms of fever, cough, shortness of breath, or any lower respiratory illness like pneumonia or acute respiratory distress syndrome, they may test you for the coronavirus. And then thirdly, anyone who is having symptoms of what we call a lower respiratory illness, which would include, and when we say lower respiratory, meaning in the lung area, that would include pneumonia or acute respiratory distress syndrome, and there's no obvious identifiable cause for your infection, i.e., for example, like the flu. In other words, if you're having fever, cough, shortness of breath, you don't have the flu, they can't figure out what it is exactly that's causing it, they may screen you for the coronavirus. Obviously, if you've had contact with someone that has it, we definitely want to make sure that you're screened. So, first, if you are out there and this has happened to you, wherein you've had contact with someone or you suspect it, the first thing we'd like you to do is call your physician. Call first. Call ahead if you can. The young lady from Chicago did that, and she did a great job of making sure she stayed in, just her and her husband. So she largely made a huge impact of decreasing the likelihood of spreading that virus in the Chicago area. So that's phenomenal that she did by her calling ahead. Her physician, and you can talk to your personal physician or the emergency room. All healthcare professionals are equipped. We are all given information directly from the CDC about the necessary steps and measures that we need to take to decrease or prevent the spread of the infection. Infection control measures is what we call them. So you want to make sure you call ahead. You want to make sure that the minute that you get into the clinic, well, let's go back. So when you call ahead, they will let you know where to go, whether you need to go to the clinic or whether you need to go to the hospital, where they have rooms that have a negative pressure. There's special rooms in the hospital that when we suspect someone of something like TB or with the SARS epidemic that they had in 2002, which actually is also from that group of virus, that SARS virus in 2002 that was in Asia, in China at that time, was from the same group or family of viruses. So there are rooms that they have special at the hospital that help to decrease the likelihood or risk of that virus spreading to anyone else and to healthcare workers in that hospital environment. So whenever we have someone that we suspect for that, and every hospital has these, most hospitals do around the country. So you want to call ahead. If you're someone that goes into a clinic and let's say you didn't call ahead, the first thing you want to do is let someone at the front know that you suspect that you could have been infected, you're nervous about it. Most clinics will have face masks that are in the clinic. If the clinic has face masks that you can put on, if you're out there and you have fever, cough, or shortness of breath and you don't know, you're like, hey, I don't know if I have the flu, I don't know if I could have been around someone, or you're in a high traffic area, or there's certain cities that you guys know, obviously from seeing the reports, that have individuals that have been affected with it, you want to make sure that you go ahead and you put on that face mask. What that's going to do is help to decrease the likelihood. You're going to put it over your face, over your nose and mouth. That's going to decrease the likelihood that you spread any respiratory droplets to other individuals. Respiratory droplets are invisible to the naked eye. That means you can't see them. But if you breathe them in, that constitutes exposure, especially if you're within a 6 feet distance from the person. So we're going to encourage you while you're there in the clinic to practice what we call great hygiene control. And I implore you, if you're out there and you're sick and you have to cough, please cough into your elbow or cover your mouth. Please don't just cough and release respiratory droplets. We are still fighting the flu here in the United States. And so we need to do everything we can to mitigate or decrease the likelihood that we pass the flu, coronavirus, or anything to other individuals to help keep our families and our community safe. So we're going to encourage hygiene control, covering your mouth when you cough, hand washing. They're what we have are called triage precautions. Don't be offended if someone asks you, hey, have you traveled outside the United States in the last several weeks? That is a question that we ask, especially in the realm of being on the front lines with urgent care. And this is not something that's new. We've done this for years. Every time when we had swine flu, when we had Ebola virus, when we have several viruses that cause a global pandemic, it's not unusual for us to start with these questions. Please just answer the questions and make it easier for the healthcare professionals. Anyone that is suspected or positive should be separated from the patients that are in the lobby area. Generally in the clinic, they'll put these individuals in a separate area in a room by themselves. You want to make sure that there's at least a 6 feet distance from the person. And then obviously if there's someone you suspect that has it, we're going to triage those patients right away. We may skip them in front of you. So we need you to be patient with us and allow us to do that, because we're doing these things in a measure and in an effort to try and keep individuals in our community, in our households, and in our country safe. So we need you to comply with that. So what does all this mean? It means a couple different things. Number one, we talked about healthcare professionals. We have a special triage mechanism that we typically use when we're faced with a pandemic like this. And secondly, we as healthcare professionals use personal protective equipment, which you spoke of earlier. Now, I've talked to a few people already this morning. Specifically, I've gotten a lot of calls and information about, hey, Dr. Celeste, I travel. What do I need to do if I have to, because there are a lot of people that travel for a living. So I just wanted to show you this, and I may not be able to show it to you in the best way, is the 3M N95 mask. This is something that I've used for years. And a lot of my patients, if you're out there and watching, you know it because you've seen me with that mask on. But this is the only mask that's been shown to help protect you, that you can utilize to protect you from respiratory droplets from someone else. So a lot of individuals that travel for a living, in other words, you have to get on a plane to be able to travel. A lot of businesses are adjusting what they do anyway. A lot of international conferences and meetings have already been canceled. You can expect to see probably more of that as this goes on, because we're trying to decrease or mitigate the risk of spreading it or bringing it back into our country, right? Right. We are blessed that we have the CDC and that the United States has all the technological advances that it does medically that help us to try and keep all of our patients safe. And so with this, that's the mask that you want to use if you're out there and you do that. And Dr. Tamara, there it is, just showing you, as well as Everett. I saw him this morning at the gym and he was asking about that. So that's the mask that you want to buy. I know that they're selling out online, so you just have to, I know that Amazon's completely sold out, but there are a couple other companies that may have them. So that's what we as healthcare workers will wear. This is what I wear when I see patients, especially in an urgent care environment. Okay, so the last thing, and to close it up, because I was trying to do this really fast, but it's a lot of information, and just trying to help keep everybody updated and help to stress prevention, to help keep everyone safe. So what you can expect going forward on a community basis is be ready or prepared that schools, we may end up, as it gets to that point, we may have business closings. There may be school closings even. I'm not saying that there have been any. I'm just saying that that's one of the things that they're encouraging you to kind of be prepared for. There may be large events, public events, that may also be canceled as a result of trying to decrease the risk or likelihood or spread of this virus in our country. And so we just want to make sure that we pay attention to those things. So we're going to review really quick basic precautions I encourage everyone to take. If you have to cough or sneeze, please cover your mouth. Please cough into your elbow, okay? Make sure that you are utilizing hand washing. I can't tell you that enough. If you're, and I know we're at events and things where we hold hands and things like that's fine. Just make sure that you have alcohol-based hand sanitizer or antibacterial wet wipes that you keep on your person. Ladies, I definitely would go by Walmart or somewhere and keep that on your person. Basic hand washing, warm water and soap for 20 seconds. You want to count to 20. Sing a song, talk about it, whatever you need to do to count to 20 to make sure that your hands are clean, and you want to do that repetitively. We especially encourage that in all healthcare workers, as we're, repeatedly exposed to viruses like the flu. We're exposed to just a lot of things, and it's just part of the job and what we do in helping to service our communities. But we want to make sure that we take those precautions. So cover your mouth when you sneeze. We talked about the hand washing. We want to make sure also that we're doing things that help build our immunity, right? Yes, let's build our immunity. So some of the basic things that we always encourage you guys to do, drinking that 2 liters of water a day if you're a woman, 3 liters for a man. The purpose of that is to help keep your organs safe, keep your immune system up, so that it can fight off a virus. Number 2, you want to make sure you're getting a good amount of protein in. Protein is a building block that's going to help your muscles function better. It's going to help everything in your body to function better because it's a building block for many of the cells, or all the cells that are in your body, really. So make sure you're doing that. Take a multivitamin. We don't always get all the vitamins and nutrients we need in a meal, correct? So take a multivitamin. These are just things to help boost your immunity. Now, and lastly, there are a few foods that you can take or eat that are natural food sources that help to build your immunity. Check out my website, 5foodstofighttheflu.com, and you can download that PDF. It talks about 5 different foods you can encourage to make a part of your diet. Things I encourage you guys, vegetables and things I encourage you moms to cook at home if you want to make sure that your children and everyone has great immunity. And let me just add, also make sure that your kids take a multivitamin too, right? Right, because we want to decrease the likelihood of spread. Teach your children to cover their mouth when they cough or sneeze, okay? So we can keep everyone safe. I encourage the use of Lysol as well as Clorox wipes too. We want to wipe down our devices frequently and frequent hand washing. So I know that was a lot, guys. Thank you so much for joining me. Thank you so much, everyone that's joined. Hi, Miss Edwards. Thank you for joining. Hi, Dr. Monica. Thank you for joining. Hi, Miss Ross Dungan. Thank you for joining. Hi, Jessica. Thank you for joining. And hi, Miss Croom. Thank you for joining. Hey, Delane. Thank you for joining. Good seeing you today. Thank you for not running over me when I was running earlier down the street. I was exercising and ran into her, but and thank you, Dr. Mashika, for joining. So, guys, if this information has been helpful to you, please share it with someone. If you're watching this in replay, please put #replay in the comment section. Share this information with anyone. Encourage all of your friends and family to take these same safety precautions and measures. Hi, Amanda. Thanks so much for joining. And in addition to that, and so lastly, I wrote a book. The last time I was on here a couple days ago, I wrote a book. Wow, I'm so excited about that. So feel free to check out my book. We're doing a pre-sale now at drcelestemdvitality.com. That's DOCTORCLESTEMDVITALITY.com. So guys, again, I'm Dr. Celeste. I'm your favorite urgent care physician. Thank you for tuning in. Thank you for joining me. Thank you for all of your support and all the congratulations. I haven't gotten a chance to get to them all because it's been a very, very hectic week. I've been out of town all week. But thanks so much for joining me. I appreciate the support, and I will continue, I promise you, to keep you updated on what's going on with the coronavirus. Thanks so much. Have an awesome Friday. And hey, let's go out and build immunity and decrease the spread of this virus as a community and as a nation. Have a good day.